I am in front of you today due to the positive tuberculosis case found within the Early Learning Center at Idaho State University. My goal is to minimize your worry on the subject and to explain to you our efforts to ensure the safety of everyone around us. Since tuberculosis is not as common as it once used to be, many people are misinformed, so I hope to ease your minds with the following information. Our Early Learning Center is one of the top-rated child care centers in Idaho, according to the Parent Handbook. This comes from our many requirements to uphold our top standards. Our staff here are extremely qualified, and many of our co-providers are students pursuing degrees in child development or education. As part of the students' program, they are to be tested at least once per year for any sign of tuberculosis, among other diseases. Tuberculosis is an infection within the lungs and is not an easily spreadable disease. Though our employee tested positive of tuberculosis, they did not show any symptoms. This is determined as latent tuberculosis. Latent tuberculosis is more common than active tuberculosis, but both are not very common in the United States, according to the CDC. It is our responsibility to ensure the safety of the children while they are in our care, and to the parents and also to the rest of the community. We are determining the spread of this case of tuberculosis at very low risk, but we are taking the necessary precautions to be sure. To further show you the low risk we are dealing with, I will explain just how tuberculosis is spread. Latent tuberculosis is a positive test of tuberculosis without any symptoms that would result in spreading the disease. In order to spread the disease, an infected person must cough up water vapor droplets from deep within the lungs, and another person must inhale those droplets directly. This can also happen by singing and sometimes talking, according to the CDC. Since the staff member did not show any symptoms, it is almost impossible that the disease has spread. Kissing does not even spread the disease from one person to another, also stated by the CDC. To be super precarious, we have cleaned and disinfected the Early Learning Center. Please do not feel that you need to refrain from bringing your child to the center. I know how low of a risk this is, but I also understand this is a very worrisome disease for children and adults. Though we uphold many specific requirements in the Early Learning Center, it is not required to have an initial tuberculosis test before becoming employed. We are only required to provide testing when such a case comes up, according to the Idaho TB manual. As of today, we are working on implementing a system to provide free pre-screening for all applicants to be tested for any potential contagious diseases, though the pre-screening must be optional. We will encourage everyone who applies to get these tests, but their compliance will not affect the hiring process. We have been in contact with the Idaho Health Department to verify the required testing that needs to be done. We have also contacted families within the Early Learning Center who may have been in direct contact with the infected person. These families have been given a time frame to go get children tested. We are requiring that these contacted people do take their children to get tested so we can determine if any further testing needs to be done. If it is determined that out of these contacted people there is a positive case, then we'll be contacting more people for additional testing. Keep in mind that this risk is so low that we are not expecting any positive results. Even if you are among the people that have been contacted, your worry is still minimal. It is necessary to realize that there may be more people throughout the community that have the latent tuberculosis virus and do not realize it because there are no symptoms. These cases are most likely not related, so just because we have a positive case here does not mean that there are not others we should be worrying about elsewhere. Tuberculosis can live within the body for years without becoming active at all. Remember that active tuberculosis is the only way for the disease to spread. It is also important to realize that the tuberculosis is treatable, according to the CDC. In reality, we can see that the spread of this tuberculosis case is very minimal, but it is always better to be safe than sorry. I hope to have eased your minds about the risk of your child developing tuberculosis. We are taking all the necessary precautions, but please feel free to contact me with any further questions.